So my project was over hydrocele of the scrotum. And the patient's clinical history is for Jack Goldstein. He's a 44-year-old man that was ordered a scrotal ultrasound by Dr. Phillips. He was having painless swelling of the scrotum, but the swelling was more intense on his right testicle. He claims it started about a week ago after having a horseback riding accident, and his date of birth is June 4th, 1979, and his medical record number is 98765. So the sonographer did the ultrasound and came back with these images. So fluid was found outside the anterior lateral aspect of the right testes. The testis and the epididymis remain homogeneous, but the anechoic fluid had some low-level debris. This is the right testicle, and then here's the fluid that is found in the anterolateral area of it. The exam continues with the left testes, where there's little blood flow and some blood flow within the right testicle. This is just a comparative pic with both color Doppler on, and as you can see, there's about an equal amount of fluid or blood, and then within the fluid around the right testicle, there is no blood. So the fluid pocket was measured, and it was 17 millimeters in length, 22 millimeters in width, and 8 millimeters in height. So the radiologist reviewed the images and diagnoses the patient with a hydrocele on his right testicle. So hydroceles are complications that can happen with trauma, severe epididymitis, and torsion. And then if there's scrotal wall thickening, it can be reactive hydrocele. So severe epididymitis is just an infection of the epididymis. And then it can also occur with epididymoorchitis, which is infection of the epididymis and the testicle. So a hydrocele is just a collection of serous fluid, and it develops between the space of the visceral and parietal layers of the tunica vaginalis. And the tunica vaginalis is just what encloses the testicles and the epididymis. And hydroceles are the most common cause of painless scrotal swelling. So there is no identifiable cause of a hydrocele, but it can occur with some factors that can happen to the scrotum. So it's more common in adults, but it can also occur in infants. So in infants, hydroceles can develop before birth if the testicular sac does not close and the fluid remains. And then the fluid can herniate into the abdomen, and it can result in an inguinal hernia. So this is what a normal scrotum should look like. And then here's the sac that encases all of the epididymis, the spermatic cord, and the testicle. And then here is what it looks like with a hydrocele. So there's all this extra fluid that just expands the sac where you would have your swelling. And then a treatment for a hydrocele is that it can disappear by itself, but if it is severe enough or if there's infection, then it can be treated with a hydrocelectomy, which is just a procedure that is done that drains the fluid. But if there is infection, then it can be treated with antibiotics in the hydrocelectomy. And then this is the sonographer's worksheet. And then here's the references.